Let me ask you something honest. Do you find yourself clearing your throat 10, 20, sometimes 50 times before lunch? You swallow, you cough, you sip warm water. It works for about 30 seconds. Then that thick, sticky feeling comes right back. It's worse in the morning. It's worse the moment your head hits the pillow at night, and nothing you eat or drink seems to fix it. Not honey, not lemon, not tea. But here's what nobody tells you. In the vast majority of patients over 55 dealing with this exact problem, the throat is not the source. Something else happening somewhere else in your body is triggering all that mucus. And most people, even many healthcare providers, never identify it. By the end of this video, you'll know exactly what's causing it, the 4 research-backed reasons behind it, and a clear plan you can start tonight. But first, you need to understand the one hidden cause responsible for most cases. And it happens while you sleep. My name is Dr. Ryan Mitchell. I'm a senior health specialist with 13 years of clinical experience working with patients over 60. In those 13 years, I've watched this exact complaint get dismissed over and over as just aging. Today, I'm not going to give you generic advice. I'm going to tell you exactly what I would tell my own mother if she were sitting across from me right now. The real causes and the real steps that work. Before we name the 4 causes, I need to reframe something important because most people have the wrong idea about mucus itself. And that misunderstanding is why this problem never gets solved. Mucus is not your enemy. Your body produces it every single day for excellent reasons. It's your respiratory system's first line of defense. It traps dust, bacteria, viruses, and tiny airborne particles before they reach your lungs. It keeps the delicate tissue lining your airways soft and protected. The problem isn't the mucus itself. The problem starts when that normally thin, watery, easy-to-clear mucus becomes thick, sticky, and slow. Instead of moving through your airways naturally, it pools at the back of your throat. And here's something most older adults have never been told clearly. Research has confirmed that mucociliary clearance, that's the medical term for your body's natural conveyor belt that sweeps mucus up and out of your airways, measurably slows down with age. The tiny hairy structures lining your airways are called cilia. As we age, those cilia beat slower and weaker. Studies show that nasal mucus transit times increase significantly after 60. Translation: mucus that would have cleared in minutes at age 40 can linger for hours at 65 or 70. This is why anything that triggers extra mucus production hits older adults harder and lingers longer. And here's where it gets interesting. Because each of the 4 causes I'm about to walk you through becomes more powerful as we age. 1. Silent reflux, the hidden cause that happens while you sleep. The first cause is the one I want you to pay the closest attention to. It's called laryngopharyngeal reflux. Most people have never heard that term, so let me explain it plainly because this single condition is the most consistently missed reason for chronic throat mucus in adults over 55. You know what regular acid reflux feels like? That burning sensation in the chest after a heavy meal. Heartburn, that's the loud, obvious version. But there is a quieter version, one that comes with no chest burning at all, one that can go undetected for months or even years. It's called silent reflux, or LPR for short. Here's what happens. There's a small muscular valve at the bottom of your esophagus, the tube connecting your mouth to your stomach. That valve is supposed to close tightly after you eat. But as we age, that valve gets weaker. Stomach acid doesn't just creep up into the lower esophagus. It travels all the way up past the chest, into the throat, into the voice box, sometimes higher. And here's the critical part. Your throat and vocal cords are far more sensitive to acid than your esophagus is. Even microscopic droplets of acid reaching the throat cause significant irritation. Your body's response produces more mucus to coat and protect the tissue. Completely logical biology. But night after night, while you're asleep and have no idea this is happening, that mucus response keeps firing. Now, here's the detail that makes this so easy to miss. Research shows that up to 50% of people with LPR have no heartburn at all, no chest burning, no obvious digestive symptoms, just chronic throat clearing, mild hoarseness, worst in the morning, and that mucus that won't quit. Cleveland Clinic data notes that roughly 10% of adults have LPR, and more than half of people who see a throat specialist for chronic hoarseness turn out to have it. Ask yourself honestly, is your throat worse in the morning than the rest of the day? Do you notice more clearing when you bend forward or lie down? Does your voice sound rough when you first wake up? Those patterns matter. One important note: if you take anti-inflammatory pain medication regularly for arthritis or joint pain, research shows that class of drugs is associated with worsening reflux. The mechanism involves a reduction in prostaglandins, protective substances that normally shield your stomach lining. Now, I want to be absolutely clear. I'm not telling you to stop any medication. Never change anything on your own. But this is a conversation worth having with your doctor. But stay with me because the next cause is even more sneaky. 2. Postnasal drip from chronic low-level sinus inflammation. The second cause is one many people live with silently because it doesn't show up the way they expect. When most people picture sinus problems, they imagine throbbing headaches, intense facial pressure, completely blocked breathing. Yes, that's one version. But in many adults over 55, chronic sinus inflammation is much quieter than that. No dramatic headache. Breathing feels mostly fine, and yet your sinuses, mildly inflamed, are producing a steady, extra trickle of mucus that drains slowly and silently down the back of your throat. That's called postnasal drip. A 2024 study of patients with chronic postnasal drip found the average patient age was 55, confirming this is very much an over 55 problem. Throat discomfort was the most reported symptom, appearing in nearly 74% of patients. Here's the pattern. You go to bed feeling fine. While you sleep, gravity does its work. Those mildly congested sinuses drain steadily down into the back of the throat. By morning, there's a thick accumulation waiting for you. That heavy feeling, that immediate urge to clear before your first sip of tea. Now, many people grab antihistamines from the pharmacy, assuming they have allergies. Here's the problem: antihistamines dry the mucus temporarily without addressing the underlying inflammation. And dried, thickened mucus is often more uncomfortable than the original problem. The approach with the strongest research behind it is daily nasal rinsing with warm saline. The European physician paper on rhinosinusitis, one of the most authoritative documents in this field, gives saline nasal irrigation a level 1A evidence rating. A 2025 systematic review in the journal Medicine confirmed nasal irrigation as effective, safe, and low cost for reducing postnasal drip. The key word is consistency, daily, not occasional. Have you ever tried nasal rinsing? Tell me below. Your experience might encourage someone else watching right now. 3. Medication-related mucus, the cause nobody suspects. This third cause genuinely surprises people because when patients think about their throat, their daily prescriptions are simply not on the list of suspects. But for many older adults, certain widely prescribed medications directly contribute to persistent throat symptoms. The most documented example is a class of blood pressure medications called ACE inhibitors. That stands for angiotensin-converting enzyme inhibitors. These drugs are widely prescribed and generally well tolerated, but they carry a recognized class-wide side effect: a dry, irritated throat and constant urge to clear it. The mechanism is well established. ACE inhibitors allow a substance called bradykinin to accumulate in the body. In susceptible people, that buildup triggers throat irritation. It is not an allergic reaction, it's a pharmacological effect. How common is this? Research in the journal Chest and across multiple studies reports the side effect in roughly 5 to 20% of users. A large study of over 27,000 patients found adults over 65 had a 53% higher likelihood of developing it compared to younger users. That makes this particularly relevant for our audience. And here's the timing detail that causes the connection to be missed. This side effect doesn't always show up right away. It can appear weeks or even months after starting the drug. So, if you began a blood pressure medication 6 months ago and your throat has bothered you since, they may feel completely unrelated. They often aren't. Again, I'm not telling you to stop any medication, but if you take a blood pressure pill and your throat clearing began or worsened around the time you started it, that's a conversation worth having with your prescribing doctor. There are alternative classes, ARBs or angiotensin receptor blockers, that lower blood pressure equally well without the same side effect. If you're still with me, drop the number 4 in the comments. I want to know who's paying attention. For dehydration and environmental irritants working together, The fourth cause is actually two factors working as a team, and together they hit harder than either one alone. The first is inadequate hydration. This sounds almost too simple, but the science is compelling. Think of mucus like honey. Warm honey flows. Cold honey is thick and slow. Same substance. Only the surrounding hydration changes how it behaves. Your mucus works the same way. Well-hydrated mucus is thin and easy to clear. Dehydrated mucus is sticky and pools. Here's the problem unique to older adults. Research has firmly established that the thirst mechanism becomes less sensitive with age. You can be meaningfully dehydrated enough to thicken your mucus without ever feeling thirsty. Waiting for thirst is a trap. It means you may live in a constant low-grade dehydration without realizing it. A practical target referenced in clinical nutrition guidance is roughly 30 milliliters of fluid per kilogram of body weight per day from all sources, including water, herbal teas, soups, and water-rich fruits and vegetables. The behavioral shift is to drink intentionally, not reactively. The second factor is environmental. Dry, heated indoor air during winter pulls moisture from the lining of your airways. Wood smoke, strong cleaning fumes, traffic pollution, scented candles, dry air conditioning all create low-level chronic irritation that keeps the mucus response stuck in the on position. These aren't dramatic triggers, they're background factors, invisible, constant, cumulative, and that's exactly why they're missed. Warning signs that need a doctor, not self-management. Before I give you the action plan, I want to be honest about certain signs that go beyond ordinary mucus issues. Please speak with your doctor promptly if you notice mucus consistently tinged with blood, even a small amount, unexplained weight loss alongside your throat symptoms, difficulty swallowing that gets progressively worse, a persistent lump or swelling in the neck, or a major voice change that isn't improving. The vast majority of persistent throat mucus in older adults is benign and fixable. Exactly what we've been talking about, but your body sometimes uses symptoms to signal something that needs professional attention. Don't self-manage those signs. See your doctor. Let me tell you about a patient I'll call Margaret. Margaret was 68, a retired school teacher who had taught third grade for over 30 years. She came to see me with one complaint that had taken over her life: constant throat clearing. It had been going on for nearly 2 years. She told me she cleared her throat so often during family dinners that her grandchildren had started imitating it. She had been to 3 different providers. Each one told her some version of it's just aging or it's probably allergies. She brought me her medication list right at the top, a blood pressure medication she'd started 18 months earlier. The timing fit exactly. Her throat clearing had started about a month after she began it. We also discussed her sleep posture, her dinner timing, and her water intake. She admitted she rarely felt thirsty and drank maybe 2 small glasses of water a day. I sent her back to her prescribing physician with specific questions. Her doctor switched her to a different class of blood pressure medication. She started drinking warm water in the morning, raised the head of her bed 2 inches, and stopped eating after 7 p.m. Within 6 weeks, the throat clearing dropped by nearly 80%. She came back to me and said, "Dr. Waterly, my granddaughter told me yesterday she misses my throat sound." We both laughed. Then she said something quieter. "I spent 2 years thinking my body had given up on me. It hadn't. Nobody had just bothered to listen. That moment stayed with me. Here is exactly what to do after watching this. 1. Stop eating at least 3 hours before bedtime. When you lie down with a stomach still actively digesting, gravity stops protecting you. 3 hours of upright time after your last meal gives your body a major advantage against silent reflux. 2. Raise the head of your bed by a few inches. Use a firm wedge or place something under the headboard legs, not just an extra pillow, which only bends your neck. Even a small incline uses gravity to keep stomach contents where they belong overnight. 3. Drink 1 to 2 glasses of warm water first thing in the morning, before coffee, before breakfast, before your medications. This single habit rehydrates your body after the overnight fast and immediately begins to thin accumulated mucus, consistently one of the most impactful changes patients report. 4. Start daily nasal rinsing with warm saline. Use a neti pot or squeeze bottle from your pharmacy. Use water that's been boiled and cooled to a comfortable warm temperature, never straight tap water. Add a small pinch of salt and optionally a tiny pinch of bicarbonate of soda. Once daily, ideally in the morning, give it at least 2 weeks of consistent practice before judging the result. 5. Book a medication review with your doctor. Bring your full prescription list and the timeline of when your throat symptoms started. If you take a blood pressure medication, specifically ask whether it's an ACE inhibitor and whether an alternative might suit you better. Never stop anything on your own. Just ask the question. 6. Hydrate intentionally throughout the day. Don't wait for thirst. Set reminders. Keep water visible wherever you spend most of your time. Aim for steady sipping rather than large gulps. 7. Reduce environmental irritants in your home. Use a humidifier in winter, avoid heavily scented candles, switch to fragrance-free cleaning products, and air out rooms after using strong chemicals. Small changes, big cumulative impact. A quick word on popular remedies. Honey has genuine soothing properties. It's not harmful and can calm symptoms temporarily, but it doesn't address the underlying cause. Dairy does not create mucus from nothing. The science doesn't support that old claim. But in some people, dairy proteins can make existing mucus feel thicker. A 2 to 3 week reduction experiment is worth trying if you suspect it, and sugar in warm drinks can actually pull moisture out of your throat tissue through osmosis. So plain warm water or warm water with a squeeze of lemon and no sugar is the better choice. Here's what I want you to take away today. That persistent mucus in your throat is not something you have to accept as a normal part of getting older. It is a signal. And now you have a research-grounded framework for understanding what that signal might be telling you and a step-by-step plan to respond to it. Silent reflux happening quietly while you sleep with no heartburn to warn you. Postnasal drip from low-grade sinus inflammation. Medication-related throat irritation, now documented across thousands of peer-reviewed patients. And the combined background pressure of inadequate hydration and environmental irritants working silently against you. None of these require you to accept a life of constant throat clearing. Each has a practical evidence-supported response, and none of them require a prescription to begin addressing. If anyone has ever told you it's just your age, I hope today gave you a very different perspective because you deserve more than a dismissal. You deserve an explanation. Your age is not a weakness. Your knowledge is your power. And the moment you understand what your body is actually telling you, you stop being a passive passenger and you become the driver again. Everything I've shared today is general health information based on 13 years of clinical experience and published medical research. Every person's situation is unique. Before making any health decisions, especially regarding medications, please consult your own doctor. If this video helped you or someone you love, share it. That one share might save someone 2 years of being dismissed. Subscribe to Dr. Ryan Mitchell for more honest senior health insights and turn on the notification bell so you never miss what's coming next. Take care of yourselves, stay informed. I'll see you in the next one.